Radiologists are trying to bring back the virtual colonoscopy for adults over 65. So what do you think of that?
Yeah, I'm never surprised because the business of medicine seems to be a very prominent thing. We find doctors investing in lots of in different kinds of tests that they do in their office, or they become doctors who use a lot of tests that are in hospitals or even in private practice. And you can't trust the numbers that are published for the incidence of cancer or of mortality for a lot of cancers, and colon cancer is one of them. We really don't know what to advise when you don't know what the data is. It's not clear.
I was thinking maybe it would be good if we just started out talking about what a virtual colonoscopy was as opposed to the regular colonoscopy that people get, because a virtual colonoscopy is a CT scan of the colon, and many times people think that they would prefer to have that because, well, the bowel prep is the same because you have to have an empty colon, but you don't have to go
a 6-foot tube up your rear end, which is not a whole lot of fun.
You just lie down and they do this CT scan, but you get quite a bit of radiation from that type of a test. And if you have a suspicious result or a positive result, you still have to have the other colonoscopy anyway. So you might as well just have a colonoscopy in the first place if you're going to have a colonoscopy.
Yeah, well, I think things get exaggerated when there are conflicts of interest that involve money. You just have a hard time knowing what exactly to do. When you look at the risk for developing these kinds of problems, we look at the February issue of the journal Radiology, where a lot of this was published, and of course it comes out positive. You see somebody else doing a study and it's not so positive. And when I researched the topic a bit so that I knew more about it, I found that the numbers varied all over the place. I think mostly the older studies kind of initially thought that virtual colonoscopy was the cat's meow, and the next thing that developed is, well, maybe it's not so good because of the reasons Vicki just gave. And now I'm not sure what to really believe from that point of view. And I have to admit that some people, who aren't going to do a colonoscopy, if they have symptoms, there's no question that's what you need to do. You wouldn't do a virtual colonoscopy in that setting, although if somebody couldn't take it because of their health, you might want to do that virtual colonoscopy.
Well, many doctors say at 50 years of age across the board, everybody should get a colonoscopy.
Well, the bulk of doctors do. But there's a lot of literature now that's even coming out of the American Cancer Society. If it comes out of there, there's really got to be something to it, because they are very pro doing all the screening tests they can because of the conflicts of interest they have. But they're even coming up saying that I have to wonder about it, because 1 in 200 times when you do a regular colonoscopy, you're going to perforate the colon, or you're going to have a GI bleed that's going to require transfusions in the hospital. And that's a big number. And you look at the benefits from it, maybe 1 in 200 people is going to have a colon cancer found that you can do something about that could save somebody's life. But if you exercise a lot, that increases your safety position there, because instead of 1 in 200, it's more like 1 in 400.
Get enough vitamin D.
Another big thing, get your sunlight and boost your vitamin D, and your chances of developing a colon cancer are even less yet. So the aggressiveness that we're taking with this procedure is a little bit too much for me. I'm not for either one of them as a routine screening test, because I think the risks outweigh the benefits, particularly in the settings I just described.
What about somebody that has had cancer of the colon? Do you advise that they go back and have these done routinely every certain amount of months?
I think it would depend on the person and what the situation was. I would certainly be more inclined to do a colonoscopy in somebody who had colon cancer, or in somebody who has a family history of lots of polyps. It's called Gardner syndrome, because the risk of developing a colon cancer is much higher in that setting.
Well, what about a virtual colonoscopy?
You might consider that depending on the setting, but that would be a personal decision that depended on lots of factors like...
Because then you're getting radiation and you've already had cancer,
well, it doesn't. It's not a good thing for anybody, but you're right. So that has a lot to do with it. So should we bring virtual colonoscopies back? Yeah, I think they're a good idea to have as one more option, but I don't think they should be used that often. I certainly wouldn't use them as screening tests, except in certain situations. And if somebody has a problem, then you have something more to think about.